I see so many of my beautiful India family here today, and it's such a pleasure, like I said, to be able to talk to all of you and share some of my experiences and maybe learn a little bit of yours. I am the medical director of one of our comprehensive multi-specialty clinics here in California, and I'm also an assistant clinical professor at UCSF, which is the University of California, San Francisco, and I am also a teaching faculty for WPATH, and that is how I met Dr. Sharma. All right, well, what I'm going to be doing is speaking a little bit about gender expression. So we're going to learn the role of gender expression as well as ways to support our patients and their families in gender expression. Now, we all know that transgender patients deserve better medical care, right? This is why you are all at this conference today, to learn how to provide better medical care. And you will learn about mental health. You will learn about medications, different procedures to support that. But how many of you actually learn about gender expression in the medical training that you're doing? And I'm going to guess that many of you are like, what is medical expression? How many of you, if your patient says, how should I dress so that when I'm riding the bus, people will see me more as the gender identity I want them to see me as? Or how should I do my makeup so that I can accentuate certain features of my face so I look more feminine or I look more masculine? I did not learn this in medical school. I'm assuming you all did not learn it in your medical training as well. So when we're thinking about our patients' goals and objectives in their journey, in their transition journey, often patients are thinking of they want safe spaces to explore expression. They want to create personalized visions of what gender identity means to them. They want to increase social skills that are more consistent or congruent with one's gender expression. An increased comfort and confidence in social transition and awareness, and to establish a community and strengthen social support. As the clinician or the provider, we actively want to involve our patient in the development of their care plans. We want to gain clear understanding of their goals. We'd like to align the care plan with their social transition goals, hormones, surgeries perhaps, hair removal. And we want to deepen the insight into the patient's transition experience. Well, what exactly is gender expression? It's the professional guidance and practical support of social transition for individuals experiencing gender dysphoria or incongruence, and it offers immediate non-invasive interventions to optimize transition-related medical and surgical care. Now, I said professional guidance, and there actually are people where this is their job, to coach people in gender expression and how to best express how they want to move about in society. It doesn't always have to be professional. There's definitely, groups of friends and support networks that also have experience. Community, for example, has experience. And with the internet and YouTube and social media, people can really share their experiences as well and their learnings. But we also want to be thinking of this in a professional sense, because everybody has individual needs, right? And so someone, for example, posting on social media, this is how I do my makeup, it is great for them, but it might not be the best choices for someone who's watching that video. And so to have someone who can really help coach or guide someone through what is going to help you wear your hair in a certain way or dress in a certain way so that your goals, your social transition goals, can be experienced. So why does it matter? Well, knowing how to move around in the world and present yourself in the world as you would like to be seen is not superficial. It's actually critical to mental health, emotional health, and I would actually even say physical safety. Gender expression care, it's a necessary component to surgeries. And in fact, in some ways, I've seen patients who felt very strongly that they were going to need a certain surgery. And when they were able to experience gender expression care, they realized that maybe they didn't need the surgery. They were able to accomplish their goals and how they wanted to, for example, look a certain way or dress a certain way without feeling that then they had to go on to surgery. And with young people, this is very, very important, right? Because many people are under the age of consent. So we don't want to be, really, surgery is not an option. And also, we want to make sure that people feel that they have choices that are immediate, so they can move around the way they'd like to be seen, and choices that are also reversible, so that if something doesn't feel right or someone changes their mind, we all know that surgery, for the most part, is permanent, right? So we want people to be able to feel that they don't have to rush into things. Also with young people, right, where maybe the family is not as on board or they're a little slower to support than, say, our patient is ready to advance. This also can buy some time, right? The family may feel more comfortable with helping or allowing that young person to express their gender more socially or publicly if they know that some of these expressive features are reversible should the patient or the young person change their mind. And also, we all know the rates of violence against transgender and non-binary people. And we also know that rates of depression and suicide risk are much higher than any other groups. So anything that we can do to help support our patients to feel that they can present more in society as their perceived gender is really going to be crucial and important. So this extends beyond the traditional aspects that you all have learned of what we consider to be transgender medical care, right? It is immediate, it is non-invasive, and it is reversible. So again, this is a huge sell in a way for people to be able to also explore what feels right and to have those choices, as well as young people, where, as you're hearing a lot today, right, that about the concerns of, well, what if the young person changes their mind, or what if their gender identity does not persist? And then this way these things can be reversible. Okay. Well, why offer it? Well, as you've also heard today, there is a lot of evidence about support for young people is going to make all the difference, right? So we know that social support is linked to better mental health outcomes among transgender adolescents and adults. And we also know that out of trans-identifying youth who socially transitioned, that most people did persist in their gender identity, with the majority identifying as transgender. Now, I would say this study was in 2022, 2021, 2022. I would definitely say as the years go on, we are seeing more and more non-binary identities coming up. And again, it's This is society is changing, right? And people are saying, no, this is who I am. This is the wording and the terminology that I use that feels right. I will say, though, that someone's gender identity, whether it's transgender, non-binary, and there's multiple other terms that people use, it is not predictive of what someone will want as far as treatments for their gender dysphoria. So someone who identifies as non-binary might still want very typical hormone regimens or typical surgery regimens when they're old enough to be able to get them. So again, it's really gender identity is not predictive of care or pathways, just to kind of throw that out there. I do have a picture here of Nina, and I like to talk a little bit about this really amazing person. Nina came out in 2015 as perhaps the youngest openly transgender person in India. She actually came out at a school assembly in front of her entire class. And she thought it was really important to, disclose her experience and her gender identity and who she was publicly, and to talk openly about her battles with depression and anxiety, and even when she was contemplating committing suicide. She credits that her survival is because of her strong social network, her family, her friends who all rallied around her to support her, and in her own words, just treated her like any other girl. And so this is really, really inspirational for our young people. Okay, well, what would be components of a specific gender expression care program? And here you can see everything that really can help patients navigate what self-expression means to them. So it could be updating legal documents with a gender marker or changing a name legally. It could be voice therapy, working with a professional who can help people with pitch and other various aspects of their voice. It could be how to assert your pronouns and your name and how to come out publicly, or at least with friends and family. Surgical options, again, if appropriate. Gender congruent hairstyling, cosmetics, timeline planning, right? Does it make sense now? Do you want to wait until more family members and allies, as we learned in the last talk, are sort of on board before more transitions, for example, like coming out at school or publicly? And then gender affirming wardrobe styles. Where I work in California, I'm the medical director of a comprehensive gender affirming care clinic, and we actually have programs that teach gender expression care. It becomes a support group, although it's not a support group. And what we do is we have various topics that actually were determined by our early cohorts. We've had multiple cohorts now, both adults and young people, and they determined what topics they felt were important to them, which you can see here. And we brought in professionals to speak of those topics with the groups. And I just put this up here so that people understand that, when we're talking to patients, as you can see, not everything is about hormones and surgery, right? Many patients want to know, how can I move about safely in the world, and to have professional coaching around that. Our program consists of, as I said, facilitated group sessions, but we also have one-on-one sessions. In fact, one of our professional coaches would take patients shopping, and she was amazing at knowing how to, on a tight budget, be able to put together multiple outfits for people that actually, again, it's not just what's a nice outfit, but what's an appropriate outfit for you, your body type, your build, and the way you want to be perceived by the people who see you when you're moving about in public. So clothing that can accentuate certain body parts, clothing that maybe certain lines that you won't look as tall, for example. So there's a lot of really professional touches that go into this that isn't just, oh, that's a nice dress or that's a nice suit. Okay. One of the first things that one of our coaches does in these groups is to help people with vision boards and to do an exercise of what are your individual goals and what is meaningful to you. This is such an amazing experience. People are so creative. This is an example of what a vision board can look like. However, we've had people do poetry, write and perform songs. Anime is very popular as well. So someone put together like an anime comic of how they saw themselves and how they wanted others, and as they progressed along. So it's a really beautiful activity where maybe for the first time in their lives, people are able to express to others the true selves that they are and how they would like to become and feel safe, right? Moving about in the world. A lot of other components, clothing, right? So as I mentioned, our coaches will help people with shopping on any kind of budget. There's also clothing exchanges, and this is a really amazing thing that a community can set up where people can bring clothing and share clothing to help other people shop. There's tips on wigs or hairstyling, as well as makeup. And again, like I said, makeup isn't always just what somebody on Instagram thinks looks good, but also there can be shading and contouring to really accentuate or decentuate certain parts of the face, or maybe even like the beard area, for example. Okay. Voice therapy is also extremely complicated. In fact, if you look at the UCSF guidelines, which is one of the major evidence-based guidelines that we use here in the United States, the chapter on gender-affirming voice therapy is extremely long, and there's many things that go into voice, right? And it's not just, is your pitch high enough or low enough to be perceived, say, on a telephone as a certain gender that, you know, the person on the other end of the line would perceive you to be masculine or feminine. But there's also a lot of other aspects that go into speech. And not just that, but how does someone laugh, or how does someone cough, right? Or how does someone move around, or their body movements, right? I'm a talker, I use my hands a lot, right? And so how can someone express themselves with their voice also across different languages and cultural situations? I will say more and more speech therapists or vocal coaches are being trained in gender affirming voice. And in fact, WPATH is starting a voice and communication therapist cohort that will be mentoring other voice therapists. So that'll be a really wonderful opportunity. Hair removal. Hair removal, when I'm talking about hair removal, I'm mostly talking about procedural hair removal and mostly on the face, right? Because this is such a visible area. We know that hormones do not make facial hair go away. And so hair removal can be an extremely important part of someone's gender transition pathway as well. We also know that there are studies that demonstrate and show that it can decrease distress and increase the subject of well-being. Of course, there are financial barriers, right? Hair removal is extremely expensive. There are topical depilatories, waxing, other things that patients can use. Actually, there are some home lasers now that are becoming available that people can, for example, order online. They're not as strong as some of the really more of the professional machines. However, they do work, and so certainly, if that's a patient's only choice or how they feel they can get something and use it discreetly, something is better than nothing, right? And for those of you who are like, well, who would get laser and who would get electrolysis? Some of this is going to be what's available to people. Classically, if both are available, laser is very good for dark hair. So if someone has gray hair or red hair, for example, electrolysis would be used for that. And also often people can do laser and they might come to a point where they've exhausted the hair removal that laser can do, and they might move on to electrolysis for what's left. Some of the other things that we should learn about, because our patients are using these methods again to help affirm their identity when surgeries are not an option, or they're not interested in surgeries, or if hormones, right, are not helpful for certain things. So binders or taping, a binder is really more like a vest or a sports bra. And here's an example of tape and ways that patients can tape the breast or chest material down. The intention here is to create more of a male contour shape that can, so that under shirts, there's like less of a perception of female breasts. And we do say if patients are going to use tape, it should be like a medical grade or sports tape, never duct tape. Okay, that's really important. And here's some tips that as providers, we want to make sure our patients understand. There actually was a study, the first study that would talk to people who actually did bind. And overwhelmingly, patients said that they had some kind of problem. Maybe tape was irritating their skin, or pushing the chest tissue down was painful, or they were getting yeast infections under that, skin where it was pressing against each other. But but what was most interesting wasn't that people were having problems, but they didn't feel they could talk to their doctor or their medical provider about it, because they were not only afraid of maybe discrimination or the provider not understanding or approving, but they really thought that their provider would have absolutely no idea how to help take care of them if they were having problems. So I do encourage you all to learn a bit. Here is a reliable resource where you can learn a bit more. And here's just some of those tips, right? That try to wear it, especially if you do have a binder, try to not wear it all day. And the binders can be ordered online or at certain stores. There are very expensive custom fit binders that also can offer skin tones. And then some patients may also just use things like ace bandages, for example, as well, or multiple sports bras. People get very creative. This is an example of packers and stand-to-pee devices. Now, these are very expensive, right? You can order them online or go to stores. And these are devices that can create bulges in clothing. Also, you can see this one on the right. You can also use it as what we call a stand-to-pee device. So if someone is in a public restroom and wants to use a urinal, they can have they can stand at the urinal and feel that they have, in a way, a more realistic, right, way to use it. And of course, there's other devices as well. Also, with things like packers, sometimes people just use clothing, right, or socks to create bulges in clothing as well. Okay, another example, breast forms and prosthetics, right? And again, depending on what people can get online or afford, is also what people will do. Also putting foam or clothing in garments, girdles, things like that to also create shapes as well. And remember, all of this is reversible. The other thing too is people can experiment in a way and say, I'm not sure what breast size I think would feel most comfortable, and experiment with different sizes and see, hey, this feels like me, right? As they go along in their process. Gaps and tucking is something that I'm going to guess many of you, if you're new to this care, do not know much about. However, this is a very common thing that people do. We don't have any research about this. GAF is actually, it's a way, it's where underwear in a way has some compression so that there's more of a, what you want to call like a female pubic shape in the undergarment. But what's happening with tucking is a few things, and I put the schematic on the right here. So in tucking, usually the testicles are pushed up into the inguinal canals where they will sit, and then the penis is tucked back, usually closer to the butt cheeks. Patients may use a gaff to secure things in place, or again, we talk about medical grade tape to help secure things in place. This is an extremely common practice where I'm actually pretty shocked that we don't have more research about it if this causes any long-term problems, right? We have the testicles up in the body cavity getting warmer. How does this affect sperm? Do patients experience pain, testicular torsion? Are they more likely to have hernias? And with the urethral meatus closer to the anus, do people have more urinary infections? Or the fact that people, when you tuck, you can imagine in order to urinate, you're going to have to kind of take everything apart, right? So patients, are they drinking less water throughout the day and not urinating as much? And we know that that can also lead to urinary problems. And yet we have no research on this. So again, some helpful tips and another reliable resource that we can share with our patients. If I'm gonna venture to say your patients probably will not mention to you that they are doing these things. And so I will often say to my patients, you know, some of my patients like to bind or tuck to help affirm their gender identity. Is this something you'd like to ask me questions about or want to know more information about? And then I can give them these resources. Okay. This is an example of one of the syllabuses we have at the institution that I work at. These classes used to be in person. When COVID happened, they all went virtual, and they work very well virtually, and they still are mostly virtual at this point. And you can see some of the different experts we bring in. You know, we bring in a voice therapist, we bring in our professional dressing coach, makeup coaches, a physical therapist who comes in not just to help people with more gendered movements that they may be more interested in, but also gendered exercise. Sometimes patients are afraid that if they're exercising, which we know is very important to bone health, especially younger people, some people might be afraid if they're exercising, they're going to be developing too much muscle. And again, they worry about perception of gender identity, of gender societals, you know, how society will perceive them. So there's ways that we can help encourage and guide people to have exercise that will be more congruent with their goals. This is an example of our pediatric workshop. So our adult workshops, which we required in the United States, the age of consent is 18. So we required that age for our adult workshops. They were so successful that our parents groups were asking for workshops for our younger people as well. And this is where it's really, really fascinating. So we have pediatric and workshops, and their parents or a parent need to be involved with them. So there are some of the facilitated sessions where the groups, the child or the adolescent and their parent will be together. And there are some nights or sessions where they are on separate tracks, where the young people are together and the parents are having their own separate class. And this is really, again, very important to give some privacy, right, as well. And but what's amazing at the end of this program, and actually one of our pediatricians went through this program with her trans daughter, and actually one of the beautiful things that happens like a program like this is initially where there's so much fear in the family, right, when the child comes out and the family is so afraid, is my child going to experience discrimination? How do I know that this will be persistent for my child, right? There's so much fear. And by the end of these series, often there's a lot more education and parents are really getting to know their children better. And that really helps foster that support and that closeness going on. So where you start with separation and fear and lack of understanding of the parent and the child, by the end of these courses, they're usually very close and better allies and supportive of their child. And you can see again here some of these categories. They're different from the adult workshops. And again, these categories were designed in our initial cohorts by our participants and their families. Here is some research, right? We all want to know, well, what's the research that this stuff actually works? And this is one of the examples of one of our gender expression care workshops that we've presented at various conferences at EPATH and WPATH and USPATH, of the experiences of our participants. And as you can see across the board, post-workshop, things are much better. Quality of life scores are much better. Mental health scores are much better. Less depression, lower anxiety, better outcomes overall. We also use, how do we assess this? We actually use a gender expression measurement tool called the GEMT, which our group designed. And it really helps to have objective data to be able to interpret this stuff. And here's just some examples of how patients have shared with us their experiences, feeling more comfortable with pronouns, more comfortable using public restrooms, and more comfortable wearing clothing and expression that aligns with gender identity. And again, feeling more comfortable and safe moving about in public. This shows scores. Basically, when you look on the right-hand side, the more green something is, the better. So the more green and yellows are reflective of improvements of all these various categories. And then so for outcomes, patients will experience improved mental health status and quality of life, express increased confidence in asserting themselves, and patients felt very strongly that the workshops really filled a critical gap in care that was beyond therapy, hormones, and procedures. And in summary, I'm just going to summarize that the gender expression care, I'm talking about professional support, right? Just like I'm talking about professional speech therapists, professional coaches, physical therapists, and we also understand that we live in a world where this isn't always readily available. Obviously, professional services typically do come at a cost unless they are subsidized in some other way. So can this be done by support groups and other people? Absolutely, of course, right? But again, we want to make sure that these are people who can really work with the individual on their goals, right? And not just someone who's saying, oh, this is how I do my makeup, you should do the same. Support for social transition is absolutely an important aspect of the overall care as well. And this is Nicole Brar, and I'm sharing Nicole's family story because in 2017, Nicole's family actually sued her school in California. She's an Indian American girl, and at 8 years old, she actually filed a lawsuit. She was in private school that, in fact, her parents sent her there because they said they were very holistic and in California, liberal, right? And actually, as Nicole was starting to transition, remember she's 8 years old, they actually then denied her the ability to wear a female uniform, to use the girls' bathroom, which was congruent with her gender identity, or to go by her name or pronouns. And she actually successfully sued her school on the basis of discrimination. Now, because of her age, Nicole could have remained anonymous, but she chose to take her story out to public, to use her name, to share her story because she didn't want other trans and non-binary children and young people to have to experience what she experienced. And she felt very strongly that her story really stood for the rights of all people and that people deserved the ability to have an education without discrimination as their authentic selves. So I don't know how many more minutes we have, but I'm going to stop sharing now. And what I'd like to do is if people could put in the chat or share with us some of your local resources that you may be aware of that you can share, because obviously I can't speak for local resources in India that can help with gender expression. But if any of you can, then please share.